Alright, this is a video that's going to talk about the things you need when you're preparing for nasal surgery, namely septoplasty and turbinoplasty, where they fix a deviated septum or they reduce the size of your turbinate so you can breathe better at night. And I just went through this, and what I'm going to do is try to give you some ideas of things that you should have before you get started. Right there you can see some cough drops, the eucalyptus cough drop, because you'll be mouth breathing for a couple of days. These are nice. And the anesthesia you get will force a tube down your throat if you do a general anesthesia. And they'll make your throat sore. So these are good kind of for the first day. Some of the throat soreness is caused by bruising, so they probably won't be very good for the second or third day. Now, what I also recommend is some kind of a throat spray, an analgesic throat spray that you could get, and that helps pretty much for the first day, but after the second or third day you're going to have to rely on other kinds of medication. Probably the primary thing that I think you should get is some kind of a nose rinse bottle. You can see the round tip on that where you would push that on one nostril and then use a normal saline in your nostril to clean the mucus out, because once you get these surgeries done you'll have a lot of blood and mucus that can't come out very well, and I found that these types of nose cleaning devices, these nasal ones, especially one like this where you can actually take it and apply pressure, will really help clean the sinuses, because you are not allowed to blow your nose for the first week or so, so you really get a lot of congestion. And so you put one of this up to the nostril, and then you slowly squeeze the bottle till half the fluid's gone. Then you go to the other nostril, squeeze the other way. I would get one early, test it, know how it works, because when you're doing it, you should go, the water should go up in one nostril and then out the other one, and then you clean in a reverse direction. You of course want to use a pre-packaged product for a normal saline. Don't try to mix your own. Don't use regular water. Use it at body temperature. Very important to use these packets rather than try to mix something your own. It's just too hard on you. Now with that, get yourself a nice little funnel and have a pot of water that's always on your sink, so that you have boiled water that you can use that's cool to a temperature that's equal to your body temperature. About 3 or 4 times a day work for me. Talk to your doctor about what you need to do. After you get past that phase, you're going to want to do something more like a normal saline mist, where you've just mist your nose a couple times a day. Another thing that works is an Afrin type nasal spray. This is a generic Afrin. They'll recommend that if you have bleeding. For some reason, Afrin will stop the bleeding. Breathe Right nasal strips are also a very good match for this kind of a problem, because it again helps your nose clear. For the first couple of days you're going to have so much congestion. Anything all day long that you can use for the congestion will help. You'll be doing a lot of mouth breathing, so get yourself a bottle of mouthwash to help keep your mouth clean and clear. Always have a bottle of alcohol around to try to work on getting the tip of your nasal spray nozzle, keep it clean, keep it sterile, and anything else that you have that you need to sterile. I put a water glass right here to remind me that one of your problems is to hydrate. 6 glasses of water a day will help you heal a lot faster, so always get a lot of water and hydrate. I don't have room here at my desktop, but another issue is a humidifier. You'll be doing mouth breathing at night for at least 3 days, probably better part of a week. And a good hot mist humidifier doesn't hurt anything. It's good to have one. There's an ionizer from, I think it's Target, that is actually directional, where you can point it to cool mist right toward your face. And that's the kind of the ones. I couldn't find that one in stock when I needed it because I started a little late. So I'm doing